Hello everyone, this is Dr. Ramya Lashmi, consultant obstetrician and gynecologist. I did my MD from PGIMER Chandigarh. I'm going to give you a quick gynecology revision. I hope this will be useful for all PG aspirants. So, importantly, we'll start with anatomy of female genital tract. Whatever I'm going to cover are the most commonly asked and very important to remember. So, two important arteries to be remembered in gynecology is uterine artery and internal iliac artery. So, uterine artery is a branch of anterior division of internal iliac artery. So, remember the anterior divisions. Anti will have the uterine artery. Next is internal iliac artery. So, it has anterior division, posterior division, but the most commonly asked question is about the posterior division. So they will give you four options and they will ask which among the following is not a branch of posterior division of the internal iliac artery. So posterior division branches are superior gluteal artery, lateral sacral and iliolumbar. You can remember it as SIL, S-I-L. Superior gluteal, iliolumbar and lateral sacral are the branches of posterior division and rest are all the branches of anterior division of the internal iliac artery. So, what is the significance of knowing these arteries? This is very important stepwise devascularization in postpartum hemorrhage. So, first uterine artery is ligated, followed by ovarian artery, and then internal iliac artery. Coming to embryology, the most important part to be remembered is about the development of the major organs of the female, which is uterus, cervix, upper vagina, and the fallopian tube, which comes out from the paramesonephric or the Mullerian duct. So, you should remember that female counterpart of development is paramesonephric or Mullerian duct. But ovary is not developed from this. So ovary is developed from genital ridge and the external genitalia, clitoris, labia majora, labia minora are developed from the structure starting with the letter genital. So genital tubercle is for clitoris, swelling is for majora and folds is for minora. And lymphatic drainage is another important topic which is frequently asked. So out of these, cervix, vulva, and uterus is very important. Cervix, you should remember obturator lymph node, followed by external iliac lymph nodes and presacral and parametrial lymph nodes. Vulva, so as a vulva is almost you can see it is like external genitalia. So it is of inguinal lymph nodes, superficial and deep. And uterus, it is pre-aortic and para-aortic lymph nodes, external iliac, and also the cornual part of uterus is supplied by even superficial inguinal lymph node. So why you have to remember these? They will ask regarding sentinel lymph node question and they can ask you as a direct question also. So you can remember like sentinel lymph node is been widely sentinel lymph node biopsy has been widely used for biopsy in cancer patients. Next topic is congenital malformations. Mostly this will be an image based question. So it can be a combined clinical scenario with an image given and they will ask you the answers. So mostly the image will not be animated like this. So it will be of HSG pictures. So they can provide you with this and they can ask you either the diagnosis or they can ask you with the complications of it. So out of these, I'll show you the pictures which is very important. So this is an arcuate uterus and this is a septate uterus. This is bicornuate uterus. So arcuate, you can just see there is a mild depression of the fundus. Septate, there is still more depression, but you can see the angle difference between these two. So this is very important to differentiate it between bicornuate and septate uterus. So don't get confused in the exam. This is a septate uterus and this is the bicornuate uterus. This is unicornuate uterus and this is uterine didelphys. Next important topic is sexually transmitted infections. So whatever I have marked here in arrow mark is very important. Organisms causing genital ulcers, mostly Trichomonas pallidum, which is syphilis, Haemophilus ducreyi, simplex herpes simplex virus, Klebsiella granulomatosis, and Chlamydia trachomatis. And vaginal discharge is the most favorite question. So it is caused by Trichomonas vaginalis, Candida albicans, anaerobic bacteria. And another important thing is Gardnerella vaginalis, which is important cause of bacterial vaginosis. Lower abdominal pain, which is one of the important symptom of PID, which is pelvic inflammatory disease, is caused by Neisseria gonorrhea, Chlamydia trachomatis, or other anaerobic bacteria. This syndromic management is important part of both community medicine and gynecology. So you have 7 named and colored kits. So here kit 1, 2, and 6 are more commonly used practically. So whenever patient is coming with cervical discharge, we give a gray kit containing azithromycin and cefixime. And whenever patient is coming with lower abdominal pain, which is a symptom of pelvic inflammatory disease, we give a yellow kit, which consists of cefixime, metronidazole, and doxycycline. So cefixime is a start dose, whereas metro and doxy is given for 14 days. Next is vaginal discharge. So it is green color kit, and we give tablet secnidazole and tablet fluconazole. Menopause and hormone replacement therapy. So menopause, we all know it is a permanent cessation of menstrual cycle by 1 year or 12 months. So here there is increase in follicle stimulating hormone, which is more than or equal to 40, and serum estradiol is less than 20 picograms per ml. So this is per se, it is not directly indicating of it is not a direct diagnostic criteria, but this will give some idea that menopause has occurred. And before giving any hormone replacement therapy, you should know the indications. So it is given mainly for the vasomotor symptoms like hot flushes and night sweats, followed by osteoporosis, senile vaginitis, where we give a topical estrogen cream, and decreased libido. So you can see here, in among these indications, there is no cardiovascular conditions. Means, so for hormone replacement therapy is not given to prevent any cardiovascular conditions in females. And this is important MCQ. Raloxifene, it is used in osteoporosis but not in hot flashes, because raloxifene by itself will cause hot flash as side effect, so you can't use it in the treatment of it. Next is PCOD or hyperprolactinemia. So you can see the important diagnostic criteria which is used is Rotterdam. So out of these three, any two should be there to diagnose it to be a PCOD. It can be either ovulatory dysfunction containing oligomenorrhea or amenorrhea, or clinical or biochemical parameters indicating hyperandrogenism, and ultrasound showing a polycystic ovarian morphology. So hirsutism, the scoring which is used is modified Ferriman-Galway score. And the treatment of PCOD is mostly lifestyle modifications followed by oral contraceptive pills of different combinations, and metformin if there is insulin resistance. For galactorian hyperprolactinemia, the treatment is dopamine agonist, which is cabergoline and bromocriptine. Urogynecology, I have tried to simplify because many have asked me, it is difficult to understand and learn. So D Lancey's 3 levels of support. You should start with this. Level 1 is cardinal and uterosacral ligaments, and level 2 is endopelvic fascia connecting connections to the arcus tendinous fascia pelvis, which forms attachments between the vagina and the levator ani laterally. Level 3 is the perineal body, and it also includes the interlacing muscle fibers of bulbospongiosis, transverse perineum, and external anal sphincter. So these are the 3 levels. First ligaments, second fascia, third is the perineal body and muscles. And for UV prolapse, there are 3 important classifications, but it can be asked either directly or as a clinical scenario. Here, whatever you should remember is the reference point, means with which point we are grading the prolapse. So in Shaw's classification, the reference point is ischial spine, and POPQ classification, it is hymen. And in Bad and Walker halfway classification also, it is hymen. Don't get confused with these different named classifications. Just remember, only in Shaw it is ischial spine, and rest of the two it is hymen. And various prolapse surgeries, at least you should know the name that uh, among these surgeries, which is prolapse surgery. So the question will be asked like that. So at least you should remember the names of the surgeries. So Fothergill's repair or Manchester operation, Leaford repair or colpoclasis, Ward Moyer surgery, sling surgeries like Purandare, Shirotkar, Veerkut, Kana, all are prolapse surgeries. Urinary incontinence, you should know three types, which is stress, urge, and mixed. And out of these three, stress urinary incontinence is the most important one because questions are based on it only. So tests for SUI are Boney's test, Marchetti, and Q-tip test. Whenever some question is asked, like what is the definitive treatment for SUI, you should pick up one answer which indicates surgery. So various surgeries available for it are Colpo suspension and tension free slings. So among Colpo suspension, you should know Bursch, Colpo suspension, and MMK, Marshall Machetti Kranz surgery. So next is tension free slings, which is transvaginal tape and transobturator tape. Abnormal uterine bleeding, I've just added two slides. One is you should know the definition of AUB according to FICO. So these four to be included. The any deviation, the frequency, duration, regularity, and the flow volume. For that, you should know which is normal. So frequency normal, it is more than equal to 24 and less than or equal to 38 days. And duration normal is less than or equal to 8 days. These two to be remembered in this table. Next is palm coin classification. So whatever AUV scenario they're going to ask, the final answer will be from this slide only. So palm coin is polyp, adenomyosis, leiomyoma, and malignancy and hyperplasia. So you can see hyperplasia is coming under this M only. Next is coin, which is coagulopathy, ovulatory dysfunction, endometrial, iatrogenic, and not otherwise classified. And in oncology, I haven't added many slides because I want you all to know all four staging, because at least one oncology question based on staging will come. Why I have included this in the slide is this is a recent one. FIGO 2023 staging of CA endometrium. It is only slight changes have been made. Means the aggressive and non-aggressive histological types have been added in each staging. And there is additional molecular classification of carcinoma endometrium, which is a separate classification. So these among these four, pole mutation and P53 abnormality is very important. So P53 abnormality is having the poor prognosis and bad survival rates. So choose to be optimistic because it feels better. So stay positive. You have come a long way and you're going to rock the exam. So don't panic more. Just do well. Stay calm. Everything will come into your mind. Thank you and wish you all the best. You can see the links of my Insta page and YouTube in the description. So you can follow the same for further updates regarding your PG preparation. Thank you.